Early in my career, as a student of medicine, I was fascinated by the complexities of the brain functions in general. And in patients with neurological disorders, each and every symptom the patient has, each and every sign the patient has, tells something about the area of the brain that is involved. My practice is restricted to pediatric epilepsy. So I see children with epilepsy. They obviously have other problems. Sometimes they may have developmental delays or speech issues or behavioral issues. I basically ask three basic questions. What is the diagnosis? And second one is what's the best way to treat this patient? And the third thing is what else is going on in the life of the patient? When you fix a child, you fix a family. That is particularly true for epilepsy. Recently I saw a patient, a 17-year-old young man who came to my clinic 9 months after an epilepsy surgery. He was having 10 to 15 seizures a day before the epilepsy surgery. During the seizure, he would suddenly stare, may look anxious, maybe a sudden change in facial expression. His dad described it as he acts like a robot. And he would do these things for 1 to 2 minutes. But the most striking thing, the most embarrassing thing for this patient was at the end of the seizure, he would let out a loud scream. And we evaluated him, and then we found that his seizures were coming from a small focus on the left side of his frontal lobe, deeper in the frontal lobe. We could do a laser ablation of that focus, and he's now seizure free. I saw him 8 months after surgery. He's had 0 seizures. When I started learning neurology, I was not married, I did not have kids. So we have to remember the milestones in development and all. When you see your child born and crawl and sit and stand and talk, then you really learn neurology and the milestones. I think it definitely helps to connect with the families and the patients well.